Hey guys, this is for maternal early warning signs. This is for labor and delivery and mother baby use. This is a trigger guideline, so it is not policy. It is not an order set. This is just guidelines on how we should be treating our patients as best practice. So our example today is going to be the hypertensive patient. So we take our patient's blood pressure. It's 170s over 105s. So we've met the Mews trigger, and that's because we've had a systolic greater than 160 and a diastolic greater than 100. So you have to have two things in the triggers in order to make a Mews trigger happen. So we want to repeat and verify the vital sign. And then if there's a PCT taking your vital signs, they need to notify the nurse right away. So when you have two or more triggers, like we just said we did, so you're going to notify the physician within 5 minutes. The patient will be evaluated at the bedside by the provider within 30 minutes of the phone call. If for some reason we can't get a hold of that provider, we need to escalate, and then we can escalate to a different physician, or if there's no other physician in-house, if it's the middle of the night, we can call a rapid OB response team, and the NPs and PAs will come down from ICU, or an ED physician can come, and you can kind of show them our guidelines, and they can help assist you with initiating order sets based on that. So we're triggering hypertension. So this is, like I said, a guideline. Just because we had a hypertensive episode and the physician chooses not to do this does not mean the physician is wrong. This is just to kind of help guide all of these different triggers. So ideally we could initiate the OB emergent therapy hypertension protocol. So let's say we did this. Now you're going to have a very clear conversation and closed loop conversation with your physician. And you're going to ask them when they want to be notified next and at what point. Because in 15 minutes, when it's time to give another dose of labetalol, they could still have an elevated blood pressure, but we wouldn't want to trigger Mews again because we're already working to fix the problem by using the hypertensive emergent therapy protocol. So the physician might say something along the lines of, after the 4th dose of labetalol, when you get to 80 milligrams of labetalol, if that's not working, call me at that point. So the goal is early recognition of multiple different things. So this kind of covers hemorrhage, hypertension, cardiopulmonary issues, and sepsis. So the goal is not to make them do specific things with this. The goal is early recognition. So we are not waiting till the patient's labs and vital signs are in the toilet to fix a problem that's already occurring that we could have caught a lot earlier. So this will be located in every mom chart and on every WOW underneath the plastic thing on the little desk part. Next, I have these little cards that were created. There's 2 little typos, but we fixed them all today. Thank you to the day shift team today for helping me with that. These are on vital sign machines, on mother baby, and on every WOW and computer, including in the L&D rooms. And that's just to remind you what the triggers are, so you don't have to go look anywhere else for that. Last but not least, we have an SBAR tool. This tool is located in the mother baby and L&D charge book. My ask to you is, if you trigger Mews, to check, write the patient's last name, or you can write their medical record number, whatever you want to do. I would like you to check what triggered it, and you don't have to fill out exactly everything on here, but I just want, yes, the physician came to the bedside, yes, clinician notification charted, because we're going to have to go back and audit these for our survey. So essentially I'm looking for just an easy way to find the charts that were triggered by Mews, so that we can establish a decent audit tool for right now, and then hopefully we'll get something better in the mix later. If you guys have any other questions, concerns, feel free to glitch book it, text or call me if it's an urgent concern, or email too. Thanks guys.